So, hi everyone. Today we'll be discussing how to examine and diagnose a mandibular fracture. So, I'm Dr. Abhin Miglani, Department of Oral and Maxillofacial Surgery. So, yes, coming to this, how we'll check for the symptoms. So, first of all, we will be seeing if there is any pain, swelling, difficulty in mouth opening, trismus due to protective myospasm. So, basically, in the mandibular fractures, so the most important cause of a difficulty in mouth opening is due to the trismus due to protective myospasm, and other symptoms we will be checking for are the tenderness over the fracture site. For example, if we have any inspected fracture site, or if the patient is complaining that from this part he's feeling uncomfortable, so we will be checking for the tenderness over that particular fracture site first. Then we will be seeing if the patient has any difficulty in chewing or swallowing. Then if we will be checking for any kind of malocclusion. So these are the symptoms which the patient will be telling to us on his own. Okay, so we just have to be prompt on our questions that आपको दर्द कहाँ पर है, आपका स्वेलिंग कहाँ से दिख रहा है, या फिर आपको कहाँ से फूला फूला लग रहा है, कहाँ से आपको सूजन महसूस हो रही है, आपको मुंह खोलने के अंदर कुछ परेशानी है, या फिर आपको किसी जबड़े के किसी हिस्से में दर्द है, या फिर आपको खाना खाने में किसी जगह से प्रॉब्लम हो रहा है, या फिर आपके दांत ऊपर वाले नीचे के ऊपर ठीक से नहीं बैठ पा रहे हैं, या फिर आपको चबाने में प्रॉब्लम हो रहा है. Then we will be discussing that how are there changes in occlusion due to the mandibular fracture. So first of all, it might be due to a fractured alveolar process, or the trauma to the TMJ or the muscles of mastication, premature posterior dental contact, or an anterior open bite due to bilateral fractures of the mandibular condyle or angle, maxillary fractures with inferior displacement of the posterior maxilla. Unilateral open bite may occur because of ipsilateral angle and parasymphyseal fracture. A posterior crossbite can occur from midline symphyseal and condylar fractures with splaying of the posterior mandibular segments. Retrognathic occlusion is associated with condylar or angle fractures and the forward displaced maxillary fractures. So, for example, in this case, so we have a bilateral parasymphysis, or simply a symphysis fracture. So, in which there is a bilateral fracture line distal to the canine on both the sides. So, there is an inferior and posterior displacement of the symphysis of the mandible in bilateral fractures in the canine area. So, this is basically due to the muscle pull. Then coming to the clinical examination of mandibular fracture. So here we will be inspecting for the hematoma, any facial asymmetry, abrasion, contusion or laceration, limited excursive movements of mandible, Coleman sign or tongue fallback, most common in the bilateral parasymphysis. So here in this case, we can be seeing the ecchymosis in the floor of mouth, which is a significant diagnostic of a mandibular body or a symphyseal fracture due to breach in the lingual periosteum. Then coming to the bilateral angle fractures, which can cause an open bite. Then a unilateral open bite may be the result of ipsilateral angle and parasymphyseal fracture. Then coming to the to the palpation. So I have made a small mnemonic. So a cat from CBI comes to palpate the mandibular fracture. So the C can be for the crepitus over the fracture site, A for the abnormal mobility, teeth, teeth mobility, avulsion, extrusion, intrusion, etc. Then C for compression test, B for bimanual palpation, and I for intersegmental mobility. Then we will be checking for the compression test. So in case of hairline fractures or undisplaced mandibular fractures, especially in the symphysis, angle or subcondylar region, which are not identifiable clinically or radiographically, compression is done at the symphysis and body region using both the palms of operator. Tenderness area reflect fracture site. Then coming to the bimanual palpation, the fracture segments are manipulated anteroposteriorly and superior-inferiorly to check for mobility. Thank you everyone. I hope you will be liking my lecture, and the next part will be on the biomechanics and the fracture healing. Thank you.